Not long ago, I saw the story of Ofek Kissing, a guy who, at the age of 19, was diagnosed with cancer, underwent chemotherapy, additional treatments and surgeries, and ultimately chose an option that seems almost imaginary, to turn his ankle into his knee. So let's understand exactly what's behind this surgery and the disease. Ofek was diagnosed with osteosarcoma, a type of bone cancer that usually affects children and adolescents and is quite aggressive. The tumor typically develops at the ends of the long bones, most often around the knee, that is, at the end of the femur, in the distal part of the femur, and in the proximal part of the tibia. The initial symptoms appear similar to a typical orthopedic problem. Pain, swelling, movement difficulties, but ultimately this is a very aggressive bone cancer that can quickly lead to a fracture. The disease itself is relatively rare, and in Israel, about 30 cases are diagnosed each year. Now let's move on to the surgery called rotationplasty. It's important to understand that this surgery is not a first or even a second option. It's really offered only as a last resort to save the knee. In the first stage, after tests, the entire affected area is amputated, the lower part of the thigh and the upper part of the shin bone. After the amputation, the entire lower part of the leg, the shin, ankle, and foot is preserved. In the next step, the shin is rotated so that the foot faces backward and is attached to the thigh. This is a very complex and slow surgery because the bones also need to be connected with a plate and screws. And also all the blood vessels and nerves are connected in order to preserve sensation and the vitality of the leg. From now on, the ankle takes the place of the knee. Movements of extension and flexion of the ankle now become extension and flexion of the knee. In the final stage, after recovery from the surgery, a custom prosthesis is fitted. It completes the lower leg, the ankle and the foot, which are now gone. But why use the ankle specifically? In such a case, since this is the last option, we would have lost that limb anyway. In other words, it's better to preserve what we have, and the ankle is a hinge joint similar to the knee. So this way we have a biological joint instead of some mechanical joint, which is less natural. Also, the prosthesis is custom made so that the foot points downward to preserve the joint as much as possible, and this way it looks like a real artificial lower leg, but as mentioned, there is a real biological joint there and not an artificial one. Another important advantage, which people don't often think about, is that after an amputation there is a lot of sensitivity in the affected area, and here, because there is a foot inside the prosthesis, it is much more comfortable and natural for the foot to be inside the prosthesis compared to an amputated thigh. In the end, the result is simple: much more natural control of the knee, much less pain, and the ability to return to an almost full level of activity. Another important point is phantom pain, which, according to reports, is much less in this situation compared to a regular amputation. Phantom pain is a condition in which a person feels some kind of sensation, such as itching, cramps, or pain, in a limb that has already been amputated, for example, a hand or a leg. The body remembers the limb through the sensory-motor map that exists in our brain, even though the limb is already gone. The areas in the brain responsible for its sensation and movement still exist. So why does this happen? When the limb is amputated, the nerves remain active. In other words, the nerves that once transmitted signals from the amputated limb to the brain are still sending signals. These signals can be sent due to pressure on a scar, because of some specific movement, or sometimes even spontaneously for no apparent reason. A brain that receives this signal interprets it as coming from the limb, meaning it searches for a limb that no longer exists. It's clear that the pain is real and not imaginary at all. These are simply nerve signals from a limb that no longer exists, but the nerves are still sending signals. Our brain often operates based on expectations and habits, which means it expects a certain signal to be sent with a specific movement. The problem is that often, even after the movement is gone, the signals or the expectation of the signals often continue, even though, as mentioned, the limb is no longer there. By the way, we know that phantom pain is often worsened during times of anxiety and fear, whereas feelings of security and calm tend to reduce the pain. Another important point is that the relative function of the limb affects the amount of phantom pain. In other words, the amputated leg of a soccer player who is used to using his leg much more than the average person will send more signals than the leg of a regular person. A good example that helps sum up the issue is an air conditioner remote. Even if the air conditioner is disconnected and we press the button, the remote will still send signals, but the air conditioner, as mentioned, will not receive them. The air conditioner or the limb are no longer relevant, but the remote, the brain, still sends signals. By the way, in rotationplasty, Phantom pain is almost non-existent because, as mentioned, the nerves are preserved and connected to the foot, so almost all the nerves are supposed to be preserved. In the end, this surgery gives the patient, after many months of physiotherapy, a life almost free of pain and with more or less full function. Thank you. This surgery demonstrates that thanks to a combination of creative and innovative medicine, the patient's mental resilience, and rigorous rehabilitation, it is possible to turn the impossible into possible.